Hi, Dr. Saxena here. Be talking about something about toxics, and it was such a difficult time when we are trying to work on this particular stuff. What is this toxicity all about? And I can always share you when any kind of new doctors they try to come and understand at our clinic. They try to come here and they stay for a week or 10 days. They just want to be like we call this as a shadowing doctor. Basically, I try to encourage that particular practice because the other doctors learn a lot about us and our practices when they just come and shadow us. They are not supposed to do practice, but somehow they can always think. So when I keep talking to this group of doctors, always I'm quite surprised that they don't understand that a few basic things like I keep talking about something like they don't understand your parabens in the shampoo or the threat of pesticides in the apartments and this outgassing of this pesticides parabens in the shampoo, even running plastics through the dishwasher, using that plastics, bisphenol A and all that, so many things. These are the toxics which that can harm health, and I'm really surprised most of the conventional group doctors who come to us, they are not aware about all this stuff. It takes time for them to understand. It's the doctors need to see. That's the reason I started training the trainer thing, where I'm just talking about people come from different parts of other places in the India, and they just want to stay here for 3 4 days or 8 days and try to learn what we are trying to work it out. So but what kind of challenge what we do get is they are not aware about this smallest details, because what happens is that they believe that we believe as a whole that the whatever we are chemicals which has been outgassing from your toys, furniture and cleaning substances have been tested, but it's not true at all. This are a lot of things, PVDs, a lot of things keep outgassing when you get that new furniture. And I was not aware as a medical doctor. I didn't understand all these stuffs. It took me a time to look into that. Once I get into this American Academy of Environmental Medicine, I started learning all these things, and I believe all these chemicals have been linked. It's not me alone. There are a lot of work, peer-reviewed studies have been done. This toxic increase of this have been instrumental in the chronic diseases like asthma, learning disability, childhood cancer, diabetes. You have heart disease as well as so all sort of cancer. So to me, if you decrease the risk of exposures and prevent the development of environmentally related diseases, and that is how we healthcare providers can and should teach the patients, even the patients or attendants of the patients, and we need to teach them how to reduce this exposure to the hazardous pollutants. Unfortunately, very few healthcare professionals have this idea about that, and we just want to see that they need this kind of they have to understand this particular thing, because most of the there was a recent study in US, and where fewer than 20% of obstetricians in US reported routinely asking the pregnant women about common environmentally exposures to toxins such as mercury in the tuna fish. Are they taking tuna fish in the pregnancy? And that was people were not aware about that. What is this mercury doing when you are pregnant and you take that tuna fish? What's going to happen? People are not aware about that. So I certainly believe that most of the mainstream doctors as well as doctors who are doing a relentless big surveys, they are not aware about all these things. my focus is on this healthcare professionals, and these are the new topics we want to convey this particular stuff, and that's the reason we created some kind of thing. And I can always show my case studies, what we have done with mercury, lead, pesticides, how this toxics can damage the health. And this is something which has to be really told to the professionals. And very few people know about this endocrine disrupting chemicals, which can contribute to obesity and reproductive disorders, as well as the neurological impairment. And we are focusing more on trying to address these issues in the forthcoming things. And we always we as I mean to say integrative medicine group, and we are keen to learn new things, at the same time give whatever knowledge we have, so that other people also should get this. So this is a typical toxics program, and I would like to take a lead in this. And this is Dr. Saxena's toxics program, which is meant for doctors. I invite every doctor who can always learn some things about how this thing can really causing a big issue. And yes, I would like to. This is not something like a conference or something like that, because what happens is that in conference you meet for 2 days, and you are overwhelmed with the things. And I just want you to understand the nitty gritty of at least 4 to 5 days. Take your 4 to 5 days off and try to come. And we can be your mentors. And yes, I always learn some things with the things. So it's good to open to this challenge. I just want to train the trainers. This is the kind of challenge. Thank you.